Now, what we're hearing from the ground, especially in countries like Saudi, is that there is a big interest in terms of co-development of solution offerings, especially from some of the sovereign AI entities that I was referencing. There's this idea, at least in the region, of we don't just want to have this reliance on Western technology and be resellers and market. We want to co-develop and we want to be a key stakeholder in the inputs and the process of developing those algorithms and developing those models in order to ensure there is sufficient representation of backgrounds and ethnicities and local population data. And I think it's great that countries are doing this more and more. I'm personally very passionate about and representation in the AI space. I've attended quite a few parliamentary debates in the UK, roundtables around ethical AI and representation, especially in healthcare. And until now, what's found is there is very little representation of women's health data in these models, of ethnic minority groups. And as you're saying, a lot of the research historically has been done on a cohort of individuals that may not be representative of the wider population. And with the way that information is being surfaced, you're not if you're not well versed in these spaces, you're not privy to these limitations of the data, and so you're kind of relying on outputs that are not necessarily in the best interest of what your profile is. So there is a lot of projects that are working on expanding that representation, making sure that these data points are in the Middle East, for example, because I'm interested in the areas of longevity and also genomic studies. There is a big interest in the area of genomics because there's been historically a lot of hereditary diseases due to tribal intermarriages within the same sort of extended families, and now governments are realizing that they want to create more of an awareness campaigns for the population, but also equip people with the risk stratification and profiling based on their genetic backgrounds and tie this into predisposition to some diseases. And so again, a lot of the genomics in the UK, for example, has historically been having one of the biggest genomics data banks in the world, but it hasn't yet been translated into a sort of an offering for the end patient. And in my opinion, that's been because of sort of a decentralized data platforms. They're now working within the NHS for a federated data platform to combine everything into one, and multiple stakeholders. That it's difficult to kind of combine all of your medical records, the genomics data, etc., to come out with something that is meaningful for the patient. In the Gulf region, whether it's the UAE or Saudi, they're leapfrogging that because they have this centralized decision making. They have these centralized data systems already, so they're able to think through go to market approaches and how to come up with products and offerings for the end patient or citizen that is more meaningful faster. So I find that very interesting. They have big programs now in some of the local universities around genetic mapping of the tribes and individuals within the region that are coming up with a lot of sort of nuances around this genetic mapping that is quite different to a Western cohort, for example, and that may have implications for certain diseases or that may impact the population. So I think this area is fascinating. It calls for much more collaboration, whether it's public-private partnerships or whether it's across countries, in order to develop a broader a set of data that could be more representative.